Focus Shockwave is cleared even to treat non-union fractures, so it's good for treating bone. It's the only thing in here besides rest and time that I can do to help assist in bone healing. All right, so you came back in 2 days ago, right, James? You saw me, was it last year?
Yeah.
You kind of dragged your feet coming in a little bit, still not sure, but you feel better, right? Wasn't sure if your neck pain was going to get relief. But what were you trying to avoid coming in to see me?
Yeah, I was trying to, I had neck pain, hands were numb, wanted to avoid any kind of, the needles and whatnot in the neck, so
yeah, cortisone,
was going to work,
surgery, trying to avoid that. We had a documented MRI, you had some stuff going on in there relative to some disc irritation on the nerve, and then had not had experience with chiropractic care. That's a kind of a hill to climb right off the bat. Like someone working on your neck when you know you have disc problems, but you were willing to try it because you wanted to avoid cortisone and I think that's a very realistic and common thread that I hear all day long, and probably really common for people that are dealing with that problem in general, right? No one is like, I can't wait to get my cortisone injection. It's gonna be awesome. Yeah. So we got good relief with traction and adjustments and McKenzie method in your neck. Might have dry needled you a little bit if I recall. It was a while ago. And then, so you're giving me a second chance now because we passed the first test.
That's about it, yeah.
Sign me up, baby. So let's see, you got, how long have you been dealing with the Achilles problem? Because you mentioned to me last year, and you're like, all right, let's sideline this. Maybe we'll deal with it one day.
Yeah, it's 10 or 15 years.
Okay.
It's a long time ago, an injury. So
you got an MRI showing that the Achilles tendon has tendonitis and some small tearing in there as well. So minor, not a full thickness tear of the tendon. That would be a surgical consult.
Right.
And then, have you ever had steroids and any injections in that area? Trying to avoid that again? All right. And then relative to that, you described it yesterday to me. You're like, it's bothering me, And I'm looking at your MRI and I'm like, okay, that doesn't seem that bad, but what I'm reading is pretty, more significant. And then you're like, yeah, it takes me a while to get going if I sit down for 15, 20 minutes. I was like, oh, okay. So it's significant enough, but you just dealt with it for a little while. So now it's not your main focus, but you'd love it to get better, right? So this is the second session, and it's not better yet, but it felt good with the treatment that you had 2 days ago, and this is the beginning, and I wanted to show you how we treat Achilles tendinopathy, or really tendonitis in any tendon, using a tool called Shockwave. I'm going to show you how I adjust the foot, do soft tissue work on the foot, as well as we combine it with physical therapy. So that's it for the talking. If you want to watch the video, you can see these modalities. If you have questions about what they do or how they help people, or if you want help finding somebody that does this stuff in your area, just comment below, and thanks for watching.
It's going to be uncomfortable. Same spiel as we did with the Focus Shockwave one. Yep. I'm just going to be asking you pain scale 1 to 10. How's that? We're kind of looking for a 5 to 6 right there.
Okay.
Cool. Awesome.
All right.
This is kind of third goal right here. 2 things there. Okay. All right, James, I'm going to start low intensity, then I'm going to work myself up here. All ready? Yeah. James, are you ready?
I am ready.
Let's do this. 1 to 10, how you feeling right over here? 6 or 7? Alright, gotcha. Just like certain spots, it feels like it's just like a massage gun, but then there's a certain spot where it's just more like tender.
Feels fine up there.
Yep. And then when we're going right into this portion. Just grab some gel over here. Hurts a little bit. Alright, here we go. Yeah. You're welcome. Almost there, home stretch.
How much do you usually get?
So this is probably.
So that is Radial Shockwave, James.
No, I didn't know that. Cool. Oh, I know. I'm right here.
James, are you ready for part 2?
Yes, sir.
Let's do this.
Sorry. No, we're left. But that's not funny though. Good job.
No, I didn't know it.
It's really good.
Yeah.
James, do you feel light sensation or no sensation at all? Feel sensation, there you go.
Not really good.
Breathe in 5. Is that 5? Mobility for 1, 2 strength. Okay.
It's one of those things.
Medium stand up right here.
Nice. Are you getting that same type of intensity right at that heel, buddy?
Yeah, there's a couple spots where it's like,
When he gets that spot that makes you hold your breath,
yeah, that's the spot. That's
this is
exactly
kind
what
of paradoxical, but like you put your hand up and say, keep it there, right? Let him know right when you're on it, and he'll hold it there for a good amount. Because I think some of that edema that you have on your calcaneus, the swelling you have on the bone of your heel, is a big pain generator for you. Okay, not just the Achilles tendon. Okay, and this machine right here, more than even the one over there, can help with the bone. It's going to treat the cells of the bone itself really well. Okay. So, kind of looping back in, right? We've got. Eddie, do you mind if I just take a pause real quick and show? So this is your calcaneus. This is the heel, where the tendon, the Achilles tendon, attaches. Okay. He's got swelling in the bone here, through here where it attaches. And that just tells you that it's been stressed over and it's an acute process. There's swelling on the MRI. He's got swelling in the bursas on the side of the heel itself. So it'll be tender to touch when that's the case. And then he has some strains or tears, small tears, of the ligament of the tendon right here. So it's called an interstitial longitudinal tear of the Achilles tendon right here. All right. You saw a radial shockwave that's going to treat the trigger points and the tension here, and it's also going to treat superficially this tendon. And then now Eddie kindly is using the focus shockwave through the attachment sites where he has some of that edema. Focus shockwave is cleared even to treat non-union fractures, so it's good for treating bone. It's the only thing in here besides rest and time that I can do to help assist in bone healing, and really the only thing that I'm clinically given the green light to do in terms of treating bone is using focus shockwave. So I'll see it for shin splints, I'll see it for stress fractures, and in this case edema itself will be treating that stress on the bone with the focus shockwave. So this will be the this will be the intention early on, and then we'll go ahead and load him afterwards. So I just wanted to share his exam findings as well as the actual MRI, and then describe a little bit more of like the differences between the radial and the focus shockwave and how we're applying it in the case here for this type of chronic injury that he's dealing with. So excited to help him out, and excited to show you guys along his journey how we've helped him out. So we got to make it happen, don't we, Eddie?
Absolutely, absolutely.
Let's go, Eddie.
Let's do it.
Let's do it.
James, did you get all that?
I got it.
Good, good. How we doing in there, Dylan?
It's going well, it's going well.
You almost finished, buddy?
Yeah, I think, you want
Throw something right in here.
Yeah, definitely.
I'll probably kind of try to get back into you want any more say in this anterior part as well?
Let's go in that calcaneofibular ligament. That's going to be a little bit more.
Might have to switch with me a little bit.
that. You're going to tape, we're just going to do ankle hinges. She's going to load it 2 different ways, get a little movement on there, and then she's got to go to work.
No, I appreciate James' reactions. Usually I'll get like a leg swing out of me, or someone giving me some kind words, but you know, my man just laughs it off right there. That's what I appreciate.
Thanks, Tristan.
Right here. Yep.
I got you.
Face paper right there for me, and then come in here. Sports week. You're good, man. It's all good. Throw that in there. Raise your head. You're welcome. Stand, roll your hands down by your side. Palm just facing up. Down there with your hands. Is that better, or is it?
Happy birthday.
You're 25 watts, 1,000 joules.
James, do you feel more sensation right down? Yeah, there we go. Didn't even have to. Nope.
Well, I'm going to see him in Philly, so the fourth thing is coming to Baltimore. And what I need to do is I'll get back to that.
So you guys use sports Billy?
Yes, and you know what, Mike? Don't ask me for help on anything. You let both Jordan and Christian tap my shoulder and turn the wrong way. You're so invested in that computer. Exactly.
Almost there, James.
You're good, man.
Cases like this, because it's really functional and assessment. I want to feel I'll put down the marks.
Okay.
That talks about how hypersensitivity and quality level relative to joint fixation cause higher muscular imbalance in trigger points at the level of that segment. So if I got like, let's just say fixation, what is functionally neurological is actually happening there, and how does it show up in the body? As it relates to other functions. This book already used, and I can see it. Segment. You can associate trigger points to that letter. This book is
Yeah, I know the DNS people like say that trigger points have to do with instability and stuff. Just
James, well done, my friend.
I tell you, there's a couple spots where it's like, it's legit.
Yeah. It's like your reg and cutaneous and reg. That's where our hot spots were at. Cool. Yep, we are all finished up here, sir.
Immobility. Proprioception. Something like that. Proprioception.
With the MRI that I picked up on you, and that you brought in, I should say, you have a history of spraining this ankle. Where does that come from? Is it sports, running?
15 years ago, had an accident sled riding.
Sled riding?
Yeah.
That was where you had some significant trauma to the foot itself. A couple ligament tears that are like, we'll call them historic. They've been there, if you will, right? So do you ever get pain in any of these areas here with your foot, or is it mostly on the back side?
It's the side there and the back.
Side here? Yeah. Okay. So you have a little stress response in the bone and the ligament over in this area on the MRI itself. I don't know if you read that, but so it'll be helpful to get a little bit of work done through here too. Have you ever worn a boot?
Do you mean like a cowboy boot, or do you mean like literally a
Well, you
walking
know what?
boot?
Now that you bring it up,
Because yes.
you ever been to Stampede in
That's
Calgary
actually my
before?
primary,
Is boots?
yeah.
Okay.
But no, I've had the thing where you sleep in it and then the walking boot thing.
Gotcha. The motor cares. We're gonna start with Shockwave here. I feel like I'm not getting quick response within the next 3-4 weeks. I might do a referral in-house to Caroline. Caroline's our integrative medicine medical provider. She does PRP injections. PRP can be really beneficial for this type of problem without having to use a steroid. And it's basically taking your own blood platelets, you spin them, you take the good stuff out, and where you have small tears like this, it can be healing for that tissue. It can help regenerate that tear, okay? And so can Shockwave, so we're gonna lean into that for a little bit, but you might be a really good candidate for PRP, and we can evaluate that in a month from now, okay? I don't think you need a boot. But you will use one after if you get PRP. That's the only time. Okay. Point your toes down towards me. Cowboy boots, huh?
For years.
For years. You from Baltimore?
I am actually.
Okay. That's like, that will be a first for me. Someone from Baltimore wearing cowboy boots.
All the time.
Point down towards me. I went to San Antonio, Texas. That's about as cowboy as I've gone in the last couple of years. And bring your toes back up. But I want to go to Calgary and go to Stampede again next year.
Oh yeah.
Have you ever been up that way?
No.
That's a really cool area. Good. Point down for me. Good. A little pressure through tib anterior over the mortise joint. I'm working on the, it's called the ATFL ligament, anterior talofibular ligament. Right in this area here, that's where he's got a little stress response on the MRI. So just ischemic compression, pin and stretch, working through this tissue. This is an ART protocol for it. This will help it feel better and move better. Okay, go ahead and pull your toes back. I want to work adjacent to the Achilles tendon here. Go ahead and push your foot into me. How was PT?
It's good.
Good. All right, and then back up. Point at me. So we got, this is our second visit. We have had Shockwave, Radial Shockwave, Focus Shockwave, ART. We're gonna do some adjustments here. Done about 15 minutes of PT. And then you're gonna And a YouTube video to boot. It's all in a day's work, baby.
Yeah.
Let's go. Point down at me. And then come back up. And I should probably stop doing these foot videos because I have like 6 ankle Achilles tendon patients right now. I'm gonna be marketing myself as the foot doctor in Baltimore pretty soon. I'm okay with it. I want to help people. Bring your toes back. Good. And point down. And relax. So, you're not gonna give me any info where the cowboy boots come from?
It's just families from Virginia. We've always sort of done it. So
Virginia is like northeast, but it tries to pretend like it's southern.
No.
South of the Mason-Dixon line?
That's
Yeah, I know.
exactly
It's farm country out there, I get it. Man, it's pretty. You go out to near Charlottesville in that area. I love it out there. My sister went to school at UVA. And I was like a senior and then freshman in college. And I would go and visit and she'd take me out. It was like the best time. I had a Jeep Wrangler. I was driving out there like every other weekend, coming out to visit her and her friends. It was awesome. Good people. You're gonna feel a little release here, okay? Just like that, okay? But a little quicker for me. Good. No pressure in the knee. It's good. Virginia, huh? There it is. Alright. Let's go 2 for 2, man. Let's make this happen. Table up, do the stretches in between the sessions.
Yep.
I'll see you next week a couple times, okay?
Yep.
Hey, thanks for watching.